One very important thing to talk about is the inflammation that can be associated with chronic granulomatous disease. It's called chronic granulomatous disease because patients form these accumulations of inflammatory cells called granulomas. We now know also that CGD patients, in concert with that, have higher levels of certain kinds of inflammatory immune hormones. This sets the trigger point to developing not only granulomas in places that can cause problems, but also makes CGD patients more likely to get certain kinds of autoimmune diseases. Of particular note is that about a third of CGD patients, not necessarily in childhood, but if followed over into their 20s and 30s, will eventually develop inflammatory bowel disease. So if you look at a cohort of CGD patients in their 20s, you will find that about a third have significant inflammatory bowel disease, which looks almost indistinguishable from Crohn's disease. And I'm not going to talk at great length about Crohn's disease, but it's worth looking it up because all of the treatments that have been developed for Crohn's disease also apply to CGD, with one caveat, that because CGD patients also have problems with infections, some of the agents used to try to control inflammatory bowel disease in Crohn's disease may cause problems in CGD. So the group that aim to suppress what's called TNF, or tumor necrosis factor, things like infliximab. But the mainstay with Crohn's disease and the mainstay with CGD for controlling inflammatory bowel disease is still steroids. And so physicians will use prednisone in modest and sometimes high doses. What we try to do is use it in a way that it's used for a while, and then we try to taper it. There are a significant subset of CGD patients that, because of their various kinds of inflammation, may end up on what we call alternate day low-dose steroid. High dose steroids over long periods of time have its own problems. So we really try to see if we can get down to nothing, but sometimes nothing isn't enough. And we end up with a fair number of CGD patients on low-dose daily or low-dose alternate day. Low-dose daily and low-dose alternate day steroids, believe it or not, are well tolerated and don't cause a lot of trouble used for long periods of time in CGD patients.